I've always wanted to go to a place and make an impact on maternal mortality. We know in the developing world it's 100 times higher than it is in North America and in the developed world. Incredibly well. At all levels, at the political level, at the health level, and with the people themselves. They are very aware of what a scourge maternal mortality is, and they're very welcoming to anything to assist them in reducing it. The majority are happening at home. 7 out of 10 women don't, at least that we've met, weren't getting any antenatal care from a trained provider other than traditional birth attendants. And when we interviewed the community workers or the traditional birth attendants, they had no medications to stop things like postpartum hemorrhage or treat postpartum infection. And so they were delivering in suboptimal circumstances. I feel very inspired. I think we have so much here in our healthcare system. I'm very proud to be Canadian. I think it'd be wonderful as good global citizens if we could help other countries to a certain degree. And the interventions that we could do are not complex things. They're very simple things that can have a huge impact. Well, again, it made me incredibly proud to be Canadian. It made me thrilled that our government would step forward with what I believe is such a responsible act. And to speak to why I think of all the Millennium Goals, I believe it's the most important one is if you look at maternal mortality, it's probably the single index of any country's healthcare system. And if you know the maternal mortality, you pretty much know every other statistic about their healthcare system. And if you can reduce maternal mortality, the implications on the improvement of the family, improvement for the next generation of children are profound. And so I was heartened, excited, and thrilled that our Prime Minister was taking that step forward. I think what it's going to do is it's going to improve the infrastructure of every developing country because it's going to improve the health of the nations. And that will be an important step out of poverty, an important step towards developing their economies, and an important step towards the health of their nations. It's going to decrease mortality. But equally and as important, it's often the first and only time that they'll contact the healthcare worker in their life. And if they when they get HIV tested at that point, they can start retrovirals and prolong their life by years and preserve the family. Also, they can prevent vertical transmission during labor.